A very good afternoon to our distinguished chief guest, all the faculty members, parents, and my fellow students. I am Nikita Sharma, pursuing second year Bachelor's of Commerce, Guru Shri Shanti Vijay Jain College for Women deems it as a privilege in organizing the state level webinar on the theme Health is Wealth, hosted by the GSS Youth Red Cross Unit. On behalf of GSS Jain College, and YRC unit, I feel extremely glad to render a hearty welcome to you all. As light removes darkness, so prayer removes ignorance. Let us commence this informative and beneficial session by seeking the Almighty blessings. A warm welcome makes an occasion more special. May I request Dr. Gssjc ma'am, Chief Coordinator of GSS Youth Red Cross Unit, to render a gracious welcome to all and read the credentials of our prominent chief guest.
Good morning, good evening to one and all present here. I am Dr. Gssjc, Assistant Professor, Department of Commerce, and YRC Unit Program Officer, Guru Shri Shanti Vijay Jain College for Women, Chennai. It's my immense pleasure to welcome our esteemed chief guest of the day, Dr. Sharanya, MBBS MD, General Medicine, Mada Medical College and Research Institute, Chennai, for the state level health enriching webinar on the title Health is Wealth, is organized by GSS Youth Red Cross Unit in commemoration of World Health Day. Hearty welcome to ma'am. It's my great honor to extend a hearty welcome to our Honorable Secretary Sir and our respected Principal Madam for this webinar. It is my duty to welcome my fellow faculty members, parents and the students who belong to JSS and various other parts of the state. Welcome you all. Now it's the time to introduce our renowned guest to the gathering. I am profoundly delighted to take this opportunity to introduce our guest of the day, Dr. Sharanya, MBBS MD, General Medicine, Mada Medical College and Research Institute, Chennai. Dr. Sharanya has rich experience in her field and is a visiting consultant in many corporate hospitals. Madam has done her MBBS from Academy of Medical Science, Kannur, Kerala, and her MD General Medicine from Vijayanagara Institute of Medical Science, Government Medical College, Ballari, Karnataka. Dr. Sharanya has constituted her career experience by serving as consultant physician in Saraswati Hospital, Chennai, registrar in multidisciplinary critical care unit in Fortis Malar Hospital, Chennai, intensive visitor to neurocritical care unit and neurosurgical ICU at Noble Medical College, and teaching in various medical colleges and fellowship in clinical hematology in Amrita Institute of Medical Science, Kochi. Madam has done a wide range of conference presentations and research publications in her area of expertise concerned. Dr. Sharanya is the recipient of gold medal in ENT, general medicine and general surgery. At present, Dr. Sharanya MD is serving as a professor, Mada Medical College and Research Institute, Chennai. We are greatly honored with the presence of Dr. Sharanya MBBS MD, General Medicine, Mada Medical College and Research Institute, Chennai, in our midst today. We welcome you, ma'am, and thank you very much for accepting our invitation to be the guest speaker for the session. Once again, welcome you all and thank you. You, ma'am.
Yes, madam. Thank you. Thank you so much for the warm welcome. Good
Welcome.
afternoon, everybody. So, the topic for today is health is wealth, especially targeting women's health, and it's being conducted in connection with the health day. Can you hear, madam? I hope I'm audible.
Ma'am, just a
Yes,
minute, ma'am. I'll
yes,
just
tell
continue
me.
and then take over. It is time to acquire
Yeah.
knowledge. May I take the pleasure of requesting our guest of honor, Dr. Sharanya Vignesh ma'am, to take over the session and enlighten our minds with her speech. Over to you, ma'am.
Can you hear me? Hello?
Yes, ma'am. Now you can continue, ma'am.
Yes, thank you so much. Yes, thank you for the warm welcome, Dr. Vishalakshi, madam. So, today's
Yes,
topic is health is wealth, especially with regards to women's health. And I'm privileged to be delivering this talk. So, Health Day was conducted on 7th April 2022. So, we are a little behind the original World Health Day. But the theme for this World Health Day was Our Planet and Our Earth, which means we are a part of this planet and we need to take care of our environment also. So, a clean air, clean water, and clean food are an integral part of our health. So, it is not just like we take care of our health and we are fine. So, we need to breathe in clean air, we need to take in clean water, clean food, clean content on Instagram, and everything else that we take inside. Like food, it's our medicine. So, that is so important. So, our planet is so important, an integral part of our health. So that is why this year's WHO theme for the Health Day is Our Planet, Our Earth. And also, I have to mention the Women's Day theme for this year because it's a women's college and we are women. The theme is gender equality for a sustainable tomorrow. So, as we all know, we are equal or even superior to men, I would say. So, our motto should be to support and uplift each other. In this competitive world, we have each other's back. We should have each other's back. Okay. So now I'll come to why women's health requires or deserves a special seminar or a webinar. So women, as we all know, are the cornerstone or the pillar of the overall family's health. We are responsible not only for our health, but our husband's health, our elders' health, our children's health. So everybody's health relies on our health. So we have to give importance, that much importance to our health. Okay. So why women's health is a separate topic? Because we are not genetically identical to men. We have different set of genetic makeup. We have our hormones. As we all know, we are very much in line with our menstrual cycle. So our hormones are very much important for us. Then pregnancy. Pregnancy is a very, very physiologically, it's a tiring, it's an exhausting thing. So that is also part of women's health. Then, as I said, we are the child's primary caregiver. It is not just breastfeeding. It is such a physically exhausting and demanding time of our lives. Then also I have to say the life expectancy of women, according to recent studies, are longer than men. So we also live longer. So we have to live healthily longer. Okay, but unfortunately, this is one of the most neglected areas. Women's health, we are known to ignore ourselves and give ourselves out for everyone else. So it is very neglected. So what are the common health issues that are being faced by women? There are some issues which are common to men and women, but more prevalent for women. And also there are some exclusively women's health issues. So I'll be just touching upon all these topics. So common health issues. First, I would like to discuss about heart diseases. I know that I'm addressing predominantly a younger population, 20s, 30s maybe. But again, we all must be really aware of heart diseases now because it is no longer a disease of the elderly. More than 60, 50 is bygone era. Now it is all 30s and 20s that are coming with heart diseases to our OPD, chest pain, ECG showing changes. So heart disease is known to be the number one cause of death in all sexes, especially more so in women. And the problem is that the classical symptom of heart disease, like heart attack, you all may know, sudden chest pain radiating to the back and sweating and vomiting, difficulty in breathing, all these are the classical symptoms of heart attack or myocardial infarction as we call it scientifically. But the problem is women may have more subtle symptoms, and also they may disregard it as symptoms of gastritis. They may just have some vague upper abdominal pain, or they just say ஏதோ ஒன்னு புடிச்சிட்டு இருக்கிற மாதிரி இருக்கு. Like, I hope everybody can understand Tamil. So they'll just say some tightness in their chest or some vomiting tendency or some lightheadedness, gyara irukku. That is all they say. And we'll see what is wrong. Enna gyara irukku, yen saapidலையா, did you not have food, did you have water, everything. And then we check BP may be slightly higher. When we see ECG, there may be signs of myocardial infarction or heart attack. So what I'm trying to say is, especially in elderly, but more so in 20s, 30s age group also, because of the recent change in lifestyle and stressful lifestyle that we all lead, we are also as much prone to heart attacks, and awareness is very important. It is okay even if there is nothing, but better to go and get checked. So you must check your blood pressure, blood sugar, cholesterol, etc. frequently. And if you experience persisting symptoms, even after your home remedies that we all do initially, if you continue to experience symptoms, you should go to a primary or your physician or your emergency and get a ECG, get checked to rule out there is nothing. So we should not neglect our heart health. Heart health is very important. So we must keep in mind that my heart attack is not only a disease of elderly, but also seen in young group now. Similarly, stroke also, each year statistics says that affects 55,000 more women than men. So it is more of a disease of women than men now. And how stroke presents is, you may all have seen, some of you may have seen in your grandfathers and all, but how they have is, they'll initially have a difficulty or a slurring of speech, then a difficulty to lift hands or movement of hands. Some may have fits. So that is the presentation of stroke, especially in early morning. So again, for this, you have to get treated at an emergency center, a CT scan of the brain. So now next, I want to come across with diabetes mellitus. Diabetes mellitus is, even in 2 days back in my OPD, I had a patient, 2 years back, somebody has told her that her blood sugar is slightly high during her pregnancy. Her parents also have diabetes, but she has not got herself checked at all for the past 2 years. One, she thought it is some stigma. I have diabetes in such a young age, so I will just do lifestyle changes. I'll avoid sugar in tea. So that is what she has left. And after 2 years, now she has come with a fever and some vague chest discomfort. When we checked her sugars, it was like 400 and 500. So you all know that is very high. Her sugars have to be around 120, 130, depending on whether we are taking it fasting or random. But 400 and 500 she came. Now, the problem with diabetes is it has no symptoms per se. Only your blood sugar value, when we check using a glucometer or in the lab, we'll know that your blood sugar levels are high. But the problem with diabetes is plenty. The complications are like they may have heart diseases, sudden silent heart attacks, then strokes are more. Diabetes can affect every single organ of your body. Your vision may be gone, you may have all nerve endings may gone, you may not feel things. So diabetes is a very, 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 very important disease. I'm not stressing enough. Diabetes is a very important disease. Even to your parents or whomever you know, you must tell them to get checked for blood sugar levels. And as I said, it is an expensive disease. So that is one of the main concerns. People say, check panna insulin poda solluvanga. They'll tell us so many medicines. It is all very costly. So we'll go and take some bitter gourd juice or some aloe vera juice, and that will only control my blood sugars. Well, you may try all that, but the cost of medicines is much, much less compared to the cost of complications. Once your kidneys or your heart or your eyes are affected, the price you have to pay for diabetes is multifold the price you may be paying for these medicines. But lifestyle changes is what I want to stress. So in the beginning itself, if you start exercising and keep your blood sugar under check, you may never end up having diabetes, especially for those people who have at risk. That is, your mother and father or siblings are diabetic, you are more at risk for getting diabetes, type 2 diabetes especially. So you must get your chip checked, be active, and lifestyle awareness. I'll come to it, but I'm just introducing the diseases. Next is obesity. Obesity is now being more common among women because of our recent changes in lifestyle. We are more used to the comforts of modern world, which is required. Tappilla, we cannot do ammikalla, article and all now. We are also working women, so we have to finish and get to work. So that the price we have to pay for this sedentary lifestyle is obesity or metabolic syndrome, it is called. So all this metabolic syndrome encompasses everything: obesity and hypertension, diabetes, hypercholesterolemia, everything. But obesity mainly occurs because of, again, sedentary lifestyle, lack of exercise. We don't exercise per se. We say veetlaye vela seriya irukku. We mop, if we don't have a help, we mop everything. But that is not enough. We have to dedicate ourselves and spend some time for walking or running or some aerobic activity. Then we don't have timely food habits only. Whatever, after feeding kids, after feeding husband, after feeding in-laws, everything, whatever is remaining at 10 o'clock, we may be eating, or we may be eating whatever is left over. So we must give awareness, and first, we must keep ourselves first. We must eat proper food. Timely, we should take food. And our sleep is also impaired most of the time, especially with small kids. And we have a lot of stresses in our life. So all these factors contribute to obesity. And obesity is a silent killer, they call. That is like it's a predetermining factor for all the other diseases. Next, I want to stress regarding anemia. So now I'm working in MADA, as Madam said, and I see so many women having low hemoglobin. They all are tired and they think it is because of summer, or they think vela romba digama irukku, or they don't have that awareness that my hemoglobin may be less. So we all know why hemoglobin is so important. Hemoglobin is the one that delivers oxygen to our brain, to all systems. So when there is not enough oxygen, we feel all sorts of symptoms. Like they may commonly say excessive tiredness, or tired, fatigue. I don't feel like doing anything. I don't have appetite. I don't feel like eating. If I start eating, I get some vomiting sensation. I'm sure some of you who are hearing this also may say all these things: inability to concentrate, padikave mudiyala ennala, I'm not able to read, I'm feeling sleepy whenever I try to take my book. So all this is not, it may be laziness, but again, it may be due to anemia. So how do you diagnose anemia? You complete blood count, and in that hemoglobin, there is an entity which, if low, is said to be, you're said to be anemic. Hemoglobin or red blood cell count. If it is less, you're said to be anemic. So the most common cause of anemia is nutritional. That is, we know that iron is one important component of hemoglobin, which is responsible for this blood oxygen carrying molecule, I said. So we must incorporate iron-rich food. Iron-rich food, we have to incorporate spinach in our diet, green leafy vegetables, beans, and all for vegetarians. And for non-vegetarians, you can have fish, especially shellfish and liver, red meat. All that are very rich sources of iron. So more so because we have ongoing losses also. So every month, we lose so much of iron in our menstrual blood. So these losses also need to be compensated. So every month when we are losing so much hemoglobin, if we don't supplement through insight by food, we'll end up becoming anemic. Okay. Then pregnancy is one important cause of anemia because we are giving the baby also our own iron. We don't have extra stores. So it is important that we keep ourselves supplemented so that we can give another life. Okay. So as I said, we have to incorporate iron-rich food. And if you feel you have increased menstrual bleeding, increased monthly periods, you have to show to your gynecologist, get it checked, and also check your hemoglobin if you feel any sort of symptoms, like I said earlier, some breathing discomfort. When I walk fast, I'm getting breathless, or I'm getting நெஞ்சிடிப்பு palpitations, it is called. ஒரே நெஞ்சிடிப்பா இருக்கு நடக்கிறது இல்லைன்னா, as I said earlier, fatigue, dizziness, etc. So anemia, I'm stressing more time because I'm seeing so many ladies more so coming with anemia in my OPD. So next is thyroid disorders. Thyroid is another very often neglected disorder. 1 in 8 women are said to be affected with thyroid disorders. Thyroid is the small gland that is there in your neck, near your vocal cords. Okay. So thyroid, there can be 2 types of disorders. Either the thyroid hormone secretion is less, so body is having symptoms of less thyroid hormone, or thyroid may be over secreting, or hyperthyroidism it is called. So the former is called hypothyroidism, latter is hyperthyroidism. In hypothyroidism, the common symptoms that you experience are maybe I'm feeling more cold in a room compared to other people. கொஞ்சம் ஏசி போட்டாலே ரொம்ப குளிரா இருக்கு எனக்கு அப்படின்னு சொல்லுவாங்க. Then constipation, difficulty to pass motion every day. Every day morning are you passing motion? கேட்டா இல்ல, once in 4-5 days. அதுவும் I'm finding it hard to pass those stools, they may say. Then they may say, நான் சாப்பிடுறதே இல்லைங்க, ஆனா I'm gaining weight. So unexplained weight gain, disproportionate to the amount of food they are eating. Then weakness. I feel difficulty in lifting weight, or my muscles are all paining and weak. I feel very tired. Hair loss is another common symptom. We all have hair loss, especially in the summer, but a lot of hair, more than the usual amount of hair loss may occur. Then a face, when we get up in the morning, face feels puffy, they may say. Then another common symptom is increased periods. So periods bleeding. So we may think it is a local reason, but thyroid hormone deficiency can also present with menorrhagia, it is called, increased menstrual bleeding per month. Now the opposite is hyperthyroidism. That is, thyroid gland is giving over thyroid to the body. So they may have opposite kind of symptom. They may always feel hot and sweating and always clammy, cold hands, and weight loss. எவ்வளோ சாப்பிட்டாலும் weight ஏறவே மாட்டேங்குது, ஒண்ணுமே சாப்பிட மாட்டேங்கிறாங்கன்னு their parent will come and complain to us. So she'll say, I'm eating well only, but I'm not gaining weight. I'm losing weight continuously. Then when you see their heart rate, the very, very fast heart rate they may have, and less bleeding than usual. Monthly bleeding is less. So all these are opposite. That is thyroid gland hyperfunctioning. So why I'm saying all these is, all these are general symptoms, common symptoms that we all experience. Does not mean we have thyroid disease, but keep in mind that these symptoms may be a sign of underlying thyroid disease, and it is more common than you think. 1 in 8 women globally experience thyroid disorders. So if you persistently experience these kind of symptoms, you should get your thyroid function test, your thyroid hormones tested, and a small dose replacement can, the relief you experience once you start these medications is tremendous, I tell you. They start with a low dose of thyroid hormone. Thyroid hormone is very important for our body. It is like the petrol in the car. It is required for running. So when you start supplementing these medicines, you feel a tremendous relief. Your quality of life is ekkachakama, it will start improving. Okay. So another thyroid disorder, you may have seen some ladies having swelling. It is called goiter. So again, same. You have to test your thyroid function. You have to go to your physician, tell them that I have these symptoms. They'll test for your hormones and treat accordingly. Now, next is osteoporosis. Is not very common in our age group, especially 50s, 60s. You may have a mother in house who says, oh, no, back pain. I'm always having back pain. Kuniya mudiyalla, weight edukka mudiyalla. I'm not able to do any activity. When I get up in the morning, I'm having back pain. All these is because of osteoporosis, or தேய்மானம் சொல்றது, like a bone is getting eroded because of calcium deficiency, vitamin D deficiency. So all of us now, because we are scared of our complexion and we don't want to go into the sun. So because of that, we are all vitamin D deficient. When we used to play in the sun and in that, when we were living, we never had this problem. But now, majority of people are found to have vitamin D deficiency, and that is correlated to even heart diseases now. So vitamin D is very important, and people are getting sachets now. vitamin D 60,000 units, one in one glass of water, milk. What? Get out in the sunlight. We have to improve our bone health. And calcium. Calcium is very important. Then only when you have vitamin D, calcium will absorb. Ana calcium நம்ம எடுத்துக்கணும். We have to take calcium rich food. You can take eggs or milk, dairy or curd. If you don't like all those, again there is ragi, that is a rich source of calcium. You can take perendine, சொல்ற அந்த creeper is there, and the podi panni, all these sesame seeds, எல்லாமே rich source of calcium தான். So you can take calcium, and also you should expose yourself to sunlight. That's what I'm saying. It is a natural healer to many diseases. இப்போ வந்து diabetes, cardiac diseases, everything people are attributing to deficient vitamin D. So osteoporosis is very, very, very common, especially more in women, because especially menopause la mudinju, once your menstrual cycles are not finished, because all those hormones are also coming down, women are more prone to have calcium deficiency, vitamin D deficiency, and osteoporosis. So it is important to stay active, exercise your joints, do yoga or whatever suits you. Some sort of exercise, sunlight exposure, and calcium rich food intake. If needed, if you feel you have some deficiencies, consult a doctor. He may even prescribe a calcium supplement for you. Now, next I want to cover urinary and genital tract infections. Again, often neglected. So it is more, men, it's not that big a problem. We both have genital tracts, urinary tracts, but the urethra in women, as we know, is much more shorter. Adala bacteria have a very short entry path into the bladder, and we may experience infection. So எப்படி urinary tract infection இருக்கும் தெரியும்னா, we may feel like passing urine very frequently. We may have burning, some irritation sensation while passing urine, pain while passing urine. Some people may find difficulty, some strangury, some difficulty in passing urine. Some may have bleeding also, but that is not very common. Itching may also be present. So these, women, it's more common. As I said, shorter urethra is one reason. But another reason is we tend to hold urine a lot, because we know how the public urinals are. We don't want to get into that stinking, disgusting place. But it is not advisable to hold your urine for so long in your body, because infection risk is very high in women. So better to find some men mari road laye po mudiyalanaalo, some safe place. You find a petrol pump or somewhere, and whenever you feel like voiding, better to go to some safe place and void off. Because you can prevent a lot of UTI, has got long-lasting impact up to kidney infection. In the urinary tract infection is a very serious thing, especially in women. And similarly, vaginal infection also, or pregnancy and the vaginal canal nu solra அந்த இடத்துலயும் இதே மாதிரி infections may happen. Again, itching வரலாம், white discharge, that is also a very common complaint. White வருது, எதனாலன்னு தெரியல, curdy white discharge, spotting may happen. So all these are also symptoms of vaginal infection. So both these need treatment, of course, but prevention என்னன்னா proper hydration, especially summer season la நிறைய தண்ணி, we have to take lot of water. Then we have to maintain hygiene, change your undergarments frequently, keep it dry, then clean properly, and as I said, void in time and get treated on time. Now next, often neglected is mental health issues. So mental health nu sonnale வந்து it is a stigma. People will start என்ன லூசா அப்படின்னு ஒரு mental health நாலே it's like it's a stigmatized topic in our country, in the world also maybe. So 1 in 5 women, they say, are affected by some sort of mental stress. Husband தான் main mental stress னு சொல்லுவாங்க, அதுவும் ஒரு mental stress தான். But I'm saying in general, stress எல்லாமே, stress is one of the main thing. Another mental health issues, anxiety, generally becoming very anxious of how am I going to do everything, panic attacks, and depression. Depression வந்து ஒரு very, very serious mental health disorder. It is not just plain sadness. Summa sad இருக்கிறது and getting over it is very common. That doesn't mean you are depressed, but you have to seek medical care. Depressed na up to suicidal thoughts varaikkum is very, very common, much more common than you think. So what I want to stress here is you are not alone. Nobody is alone. Even I have got depressive thoughts. Ennada pandrom nama, what are we doing? Ellame, it is very, very common, especially in student life. Doesn't mean you're depressed. It is not wrong. It is not bad. You're not alone. Adha na solla varen. There are a lot of helplines. It is not wrong to seek care. So in the current world, in such a competitive world, we are not having our family's support, or we think they don't understand this generation. It's a different generation. So what I'm saying is talk to people. Talk about whatever you feel, whomever you trust. People are more helpful than you think. So if not, இந்த மாதிரி டாக்டர்ஸ்ட வந்து பேசுங்க, என்னன்னு சொல்லுங்க, you let it out, whatever is stressing you. இப்பதான் வந்து 2 days back one ward sister, she took some 50 tablets of some medicine and came to OPD. Everybody is stressed னு சொல்றேன். She's got a small kid and it's feeling so bad. She could have just talked to someone near her, but people somehow think சொன்னா என்ன நினைச்சுப்பாங்க, what will they think? They'll think I'm not strong. They'll think what, I have everything, why should I feel depressed? All these are stigmas. People are more helpful than you think. Talk to people, let it out. If you feel you cannot confide in your parents, confide in your siblings, cousins, friends, or of course therapy. Therapy is a very 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 normal thing. நம்ம எப்படி தலைவலிக்காக டாக்டரை காமிக்கிறோமோ அதே மாதிரிதான் மென்டல் ஹெல்த் இஷ்யூஸ்க்காகவும் டாக்டரை காமிக்கிறது. Showing a psychiatrist is very 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 normal. It is another doctor seeing another system. So that's why I'm stressing on mental health issues. They are more so in women, because guys, men, you can see they'll go and socialize office or over a glass of beer, they'll go discuss all their problems, free therapy, finished. But women, most of the time, they are so held up in work, they are at home, they may not have people to share their issues. They don't want to let out the issues in their house, outside. On that context, abuse, physical abuse, mental abuse, verbal abuse, it is so common, and women are like shamed to not let it out. வீட்டுக்குள்ள நடக்கிறத வந்து வெளியில சொல்லக்கூடாது அப்படின்னு எல்லாம், all these is false. Don't even get into. So all these things are very very common in the society. So mental health issues of women need to be addressed properly, and for this you have to seek help. There are helplines also, like suicidal helplines. There are Kiran solite mental health support system irukku, or again as I say, talk to a therapist. So next I want to cover cancers. Cancer is one of the leading cause of death among men, women, everybody. But commonly lung cancer is said to be the leading cause of mortality. And in addition to lung and colon, stomach cancer, women specific cancers na breast cancer irukku, ovarian cancers irukku, endometrial cancers and cervical cancer. So breast cancer ngiradhu we all know is very very common. You may know 2 people who have breast cancer and treated. So it's almost like treatable if you find it out in the early in situ stage. Like if you find it out, it's like any other chumma or infection mari, you can treat it off. So if you feel, what do you say, early detection is the treatment number 1 most curative. Na cancer anchana avlodha appdin illa. Ipo technology has improved so much. If you do early detection, it is as good as living cancer free. Cancer illada mari you can live ngara mari. So early detection ku enna, breast self examination it is called. So every once in a month or so, when you bath, just examine your breasts for any mass, chinnada eda tadippu or mole mari. It is normal also in our reproductive age group. It's normal to have these kind of cysts, fibroadenoma na solluvom. But in your mothers or even younger age group it is getting common now. But generally hard masses or some discharge varudhu nipple la, edadu or foul smelling illana bloodish discharge varudhu in the mass tadippu perisa, it's slowly increasing in size. I'm not able to move it. Or axilla ku keela there is a mass that's called a lymph node. So idella neengale if you find out, because going to a doctor is like a last stage thing, and routinely doctors may not examine your breast, though they are supposed to, but it's inappropriate to go and examine someone's breast in that mari. So breast self examination is very very important. And if you feel or you have some doubt, you go to a gynecologist. Mammogram no test irukku, adu valikira test kedaiyadu. So people may think adu breast press pannu na adalam panna, I won't do all that. So now there are digital mammograms available. So early screening for if you feel some sort of a discomfort enna iruknalo, not you per se, I'm saying your parents or aunties, uncles, aunties, not uncles. So aunties and mari, if you feel, get a gynecology opinion and a mammogram for breast cancers. Cervical cancers and the cervix is the lowermost part of your birth canal above the vagina. And cervical cancers, there is even a vaccine available. I don't know if you know, it is called the human papilloma vaccine. It is pre-adolescent girls. It is a vaccine preventable cancer now. And cervical cancer is more common than we think. அது வந்து இட் presents with இந்த மாதிரி bleeding, especially menopausal age groupல periodsலாம் நின்ன அப்புறம் திருப்பியும் bleeding ஆரம்பிச்சா we have to think of cervical cancers, endometrial, uterus ஓட cancers. இதெல்லாம் வந்து ரொம்ப காமன். That's why I'm telling more and more not to scare you or anything. So what is done is ஒரு 45 years or 40 years அப்புறம் it is recommended to have a routine gynecological checkup, and they do something called as pap smear. PAP smear. pap smear வந்து இந்த cervical cancer ஏதா இருக்கான்னு rule out பண்றதுக்காக yearly once or so they advise. And again, yeah, so that is about cancers. Then about infections. Infections in general, that is common to both sexes. Infection generally affects you if you have less immunity. But ladies are more prone because யாருக்கு வந்தாலும் we are the caretakers. We have to stay in close proximity to them. For corona time, I think many people would have realized how we cannot isolate ourselves. We have to do work and isolate ourselves. So we are more prone to any sort of infection that may happen. I heard from one of your professors that tuberculosis vandhudu some person in your campus. So nothing is to be stigmatized. அது வந்து droplet infection. Now when you cough, it is mycobacterium tuberculosis. There is one bacteria which goes and affects your lung. So that is all very much treatable now if you test your sputum. Or kabatta வந்து காலையில if you give for testing to a nearby hospital, they do sputum AFP, acid fast facilite test in the பண்ணிட்டு you can detect 6 months of medicines, you are TB free. So முன்னாடிலாம் TB வந்ததுன்னா they used to put in sanatorium, or they used to build a dedicated facility to discard, I can say, to abandon all these TB patients because they thought it was not treatable and it will affect everyone in community if you let them loose. In the leprosy, TB, all these are stigmatized diseases. If you get once, everybody shuns you. அங்க போய் விட்டுருவாங்க. If you உயிர் பழச்சா you will come back. It was like that. But now it's not like that. Tuberculosis, leave alone tuberculosis, HIV, AIDS வந்து இப்ப வந்து it is very much under control. Fully treatable case reports தான் இருக்கு. But it's all very, very treatable diseases now. At least it can be kept in check. So infections, why I'm saying is if you have some fever or unexplained weight loss or cough, excessive sweating, cough with some bloody sputum. So I just wanted to touch on tuberculosis because it was there in your campus. So cough, bloody sputum, some weight loss, unexpected evening rise of temperature, in Mariella irukna, it is a symptom of pulmonary tuberculosis. Okay. So next one, I'll just touch on reproductive issues. So as we all know, fertility வந்து இப்ப வந்து ஒரு leading cause of concern among women. கல்யாணம் ஆகி ஒரு வருஷம் ஆயிடுச்சு, 2 வருஷம் ஆயிடுச்சு, no good news. அது வந்து ஒரு leading cause of concern இப்போ. So fertility due to multiple reasons, இப்போ women and men, that also I want to include. Equally, men are equally responsible for fertility issues like women. So women la enna issue na lifestyle changes are the number one culprit, they say. Lifestyle, food, or stressful life, everything. So one of the disease that comes in this purview is Polycystic Ovarian syndrome. Some of you may know it again, PCOD in solradhu. So that is like it's a lifestyle disease where your ovaries have multiple cysts. So these cysts, this condition is responsible for ovulation. So நமக்கு தெரியும் pregnant ஆகிறதுக்கு ovulation must happen. We must give ova. So this ovulation may not happen, and even other complaints may be there other than ovulation. என்னன்னா hirsutism னு சொல்றது, அதாவது we may develop hair in male area, so male beard, male mustache மாதிரி. Females also may develop excessive hair along their finger line, cheek, chin. In masculine areas, they may have hair. Then period disturbances, that is 3 monthly once only I'm getting period, 4 monthly once only I'm getting period. Sometimes it comes, sometimes it does not come. Then weight gain, all these things may happen. So இது வந்து it is also as I said முன்னாடி சொன்ன மாதிரி இந்த metabolic syndrome, it is PCOD is also related. Future they have risk for diabetes, hypertension, heart diseases, ovarian cancers even. So PCOD is treatable again. Main thing for PCOD, so how do you diagnose? I'll tell you. So you have to go to your gynecologist or physician if you have any of these symptoms like difficulty conceiving if you're married, இல்லைன்னா இந்த மாதிரி மேல் பேட்டர்ன் ஹேர் இது பீரியட்ஸ் டிஸ்டர்பன்சஸ் ஹேர் லாஸ் வெயிட் கெயின் அண்ட் அந்த இது சொல்றது வெயிட் கெயின் மட்டும் இல்ல லீன் பிசிஓனும் இப்ப தெர் இஸ் அன் என்டிட்டி வேர் வெரி தின் பீப்புள் கம் வித் மல்டிபிள் ovarian cyst. So how they find it out is they test your hormones, androgens னு சொல்ற hormones test பண்ணுவா, prolactin, all these hormones are tested and ultrasound scan of the abdomen is taken. அவங்க வயரோட ஸ்கேன் பண்ணிட்டு they see if the ovaries have multiple cysts. So you do this checkup and the doctors may prescribe medicine. அதை எடுத்துட்டா you may be as much as normal and lifestyle changes, exercise, taking proper diet. They'll prescribe a PCO diet மாதிரி, avoiding certain food, etc. So it is very much treatable. So these symptoms are very common in the periods disturbances. நம்ம ஸ்ட்ரெஸ்ன்னு விட்டுறக்கூடாது. So underlying there may be these cysts and all சொல்லுவாங்க. So that is one reproductive issue that I want to cover. Then again pregnancy. Pregnancy is the female testing time னு சொல்லலாம். It is a very very biologically demanding period in our lives. முன்னாடி எல்லாம் they were considering it very normal. அப்படியே farmக்கு they'll go, they'll keep on working, give birth to the baby in the farm, then bring back the baby. Now it's not like that. They're all having precious pregnancies. எல்லாமே கொஞ்சம் கஷ்டப்பட்டு we have in advanced age, stressful lifestyle. We have 1 or 2 kids. It's not like we have 8 or 9 kids that we can afford to be careless. So pregnancy is again a very very stressful period in women's lives. Previously இருக்கிற diseases may exacerbate during pregnancy, like autoimmune diseases, diabetes if you already have, all these have risk for exacerbation during pregnancy, and also new onset diseases like anemia na sonnadhu, that is very much common in pregnancy. Then calcium deficiencies irkalam, then again diabetes you may get new onset in pregnancy, etc. Hypertension. So all these are very much important. So nutrition adella is very much important. As I said, iron and calcium supplementation is very important. And mental health, which I mentioned earlier, postpartum depression nu solradhu, postpartum blues or postpartum depression. So after you have a baby, you're supposed to be very elated and very happy. I'm not feeling happy. I'm feeling very upset. That initial maladjustment is very common, but more than usual if you're feeling sad, always crying, unexplained crying, not eating. So it may be a symptom of postpartum depression. You need to get help. So it is very common, I'm trying to say. And also because if women have less support systems, as they say, it takes a village to raise a child nu solra mari, women do not have that village now. Nammale da we're going to work, taking care of kid, everything. So there is lack of emotional support, and also knowledge regarding contraception I want to mention in this. So after first child, they didn't use any contraception. Immediately they got second child. So now what to do? So also ask your doctor regarding contraceptive, wherever relevant, married, with, after kid, before kid, wherever relevant, you must forthcomingly ask your doctor regarding contraceptive advice. So that is it about the diseases. I want to give a short summary that women are very, very, very important part of this community. They are an integral part of the society, and our health is not only our health. Our health determines the health of the family, health of the society. Happy women, happy family, happy society. So health challenges affect women more because we are less forthcoming with it. Men are easily approaching doctors. Women don't come forward so much. Oh, evlo vela irukku, veetu velaye seriya irukku, idukku appuram eppo poi doctor kamikiradhu, or we have our self neglecting or attitude. We have putting ourselves last. So I want to tell that we must put ourselves first, and self care, very very important. It is not an offense. It is not a sin like people say. There is a kid and you're going and relaxing. It's not like that. We have to take care of ourselves first, have nutritious diets, dedicate time for exercise, and dedicate time for whatever you find pleasure in. Music, painting, dancing, however busy you may be. Exam irukattum, but have time for relaxation. Do meditation, yoga, whatever suits you, journaling or whatever, and timely checkups. So as I said previously, many symptoms I have mentioned, even if you have no symptoms, better to get checkup done once you're 45, 50. Diabetes, hypertension, as I said, pap smear, all these either. Then equal importance to mental health should also be given. Talk to people, socialize. So it is not wrong to put women first, as contrary to society's beliefs. Unga cup full, only if your cup is full, you can pour to others. That is what you should keep in mind. Always keep your cup full. Only filled cup can fill to others. So happy health, happy women's health to everybody. Have a nice day. Thank you so much. Okay. Yes.
Thank you, ma'am.
Thank you so much. I hope it was informative to you all.
Yes, ma'am. It was great session with you. It's
Thank you.
time for interaction. Spectators who have any queries can type in the YouTube live chat.
I hope I was not too fast. It is okay for you?
Yes, ma'am.
Thank you. Weight reduction, it's individualized. Sometimes your height, your weight, we have to see our BMI. So body mass index, your weight by your height. We have to see what is appropriate for you. Then again, lifestyle changes. Eat properly. Try to have an early dinner. Good breakfast, poor dinner. Get exercise. Move. Get moving. Walking, run. Always be happy. Don't stress too much about the measuring scale. And the value. Don't worry so much. Be active. Be happy. Weight is the last thing to reduce. The first things that will normalize is your periods will normalize. Your mental health will normalize. You will be more active. Your energy levels will increase. Idella you see. Weight வந்து last பாருங்க. I hope that's okay. Nikita? Yeah.
Yes, ma'am. Thank you.
Sure. Any more questions?
No, ma'am.
Sure.
Now let's commence the session with the vote of thanks.
Sure.
Thankfulness is the best form of courtesy. On behalf of GSS Teen College for Women, I take this opportunity to propose the vote of thanks. I firstly thank the Almighty God, whose grace has made the state-level health-oriented webinar successful. I express my heartfelt thanks to our guest of honor, Dr. Charanya Vignesh ma'am, who has presided over the session and enabled us to acquire knowledge. We felt that it was highly beneficial to us. I extend my gratitude to our correspondent, Dr. Gautam P. sir, and our principal, Dr. M.K. Malati ma'am, for their guidance and support. I convey my heartfelt thanks to Dr. Vishalakshi ma'am for her efforts in arranging this program. I also express my special thanks to all the faculties who have joined us from GSS and other institutions. I also convey my heartfelt thanks to all the parents for taking part. It is my duty to thank all my fellow students for their participation. Thank you all once again. Thank you, ma'am.
Thank you. Good day.